Good morning, Dr. Ida Khan. I'm from Pediatric Pod Concierge in Pediatrics. Just having a little bit of coffee this morning. So I wanted to just come on board and talk a little bit about newborn jaundice. Often, this question comes up with our new babies, that why does, once the baby is discharged from the hospital, I always tell my mamas that, you're going to end up needing to get that appointment right after, once you're discharged. Because number one, we want to make sure that the baby is doing okay. Want to make sure mama's doing okay. Want to make sure the baby hasn't lost too much weight, and want to make sure that the baby is not jaundiced. And it is very normal. Those first 10 days, the weight drops down, then comes back up by the 10th day. But often when mamas go home, especially with that first baby, sometimes the milk isn't coming, maybe they're not feeding well, they don't realize the baby's not feeding enough, and if there's no other risk factors, sometimes because of dehydration or not feeding enough, that jaundice can go up. So we usually do a jaundice check at that first visit, and we're very blessed to have a concierge phlebotomist who will actually go to families' houses to get that done, so it saves the parents a trip to a lab to get that done. But again, that is the importance, and we want to make sure that the baby doesn't have rising jaundice levels, that yellowness in the skin, and we want to make sure that the baby is feeding appropriately. So you want to make sure that you get that appointment once you are discharged from the hospital.